In the realm of infectious diseases, human metapneumovirus, or HMPV, often flies under the radar. Many have never even heard of it. However, this common respiratory virus can cause a range of illnesses, from mild cold-like symptoms to more serious respiratory infections. It affects people of all ages, but young children, older adults, and individuals with weakened immune systems are particularly vulnerable to its more severe effects. HMPV is often overlooked because its symptoms frequently mimic those of other common respiratory viruses. This can make diagnosis challenging without specific laboratory testing. Despite its relative anonymity, HMPV is a significant contributor to respiratory illness globally, highlighting the importance of understanding this often invisible foe. While HMPV might not be a household name, its impact on respiratory health is undeniable. As we delve further into the world of HMPV, we gain valuable insights into its behavior, global impact, and most importantly, how to protect ourselves and our loved ones. Understanding HMPV empowers us to make informed decisions about our health and well-being. The story of HMPV begins relatively recently. In 2001, Dutch researchers identified this previously unknown virus while investigating a series of respiratory illnesses in young children. Despite its late discovery, evidence suggests that HMPV has been circulating in human populations for at least 50 years, silently contributing to respiratory illnesses worldwide. Prior to its identification, HMPV infections were likely misdiagnosed as other respiratory illnesses, masking its true prevalence. The discovery of HMPV marked a significant step forward in our understanding of respiratory viruses, allowing for more accurate diagnosis and targeted research. The relatively recent identification of HMPV underscores the constantly evolving nature of infectious diseases. New viruses and strains emerge, highlighting the importance of ongoing surveillance, research, and our ability to adapt to new health challenges. In recent years, there has been a noticeable increase in HMPV cases globally. Countries like China, the United Kingdom, and the United States have reported significant surges in infections, raising concerns among health officials. While HMPV infections are typically seasonal, occurring predominantly in the winter and spring months, the recent uptick in cases outside of these typical periods has raised questions about changing viral patterns. Several factors could be contributing to this global increase, including relaxed COVID-19 mitigation measures, increased international travel, and the natural cyclical nature of viral outbreaks. The rise in HMPV cases serves as a reminder of the interconnectedness of global health and the importance of international collaboration in monitoring and responding to emerging infectious diseases. While the increase in HMPV cases is undoubtedly concerning, it's crucial to approach this information with a balanced perspective. Health authorities worldwide are actively monitoring the situation, and research is ongoing to better understand the reasons behind the recent surge and develop effective countermeasures. Distinguishing HMPV, comparing and contrasting respiratory viruses. Understanding the similarities and differences between HMPV and other respiratory viruses, such as RSV and COVID-19, is crucial for accurate diagnosis and appropriate treatment. While all three viruses can cause respiratory illness, they have distinct characteristics. HMPV and RSV share some similarities. Both are common causes of respiratory infections in young children, and both can lead to more serious complications like bronchiolitis and pneumonia. However, they are distinct viruses with different genetic makeups. COVID-19, caused by the SARS-CoV-2 virus, is another respiratory virus that has garnered significant attention in recent years. While COVID-19 shares some common symptoms with HMPV and RSV, such as cough and fever, it is distinct in its transmission patterns, mutation rate, and potential for long-term complications. Understanding these nuances helps healthcare providers make more informed decisions about patient care and public health interventions. Shielding ourselves, prevention and management of HMPV. While there is currently no vaccine available for HMPV, several effective preventative measures can significantly reduce the risk of infection. Good hygiene practices, such as frequent hand washing with soap and water or using alcohol-based hand sanitizers, remain our first line of defense against HMPV and other respiratory viruses. Covering coughs and sneezes with a tissue or the crook of the elbow helps prevent the spread of respiratory droplets containing the virus. Avoiding close contact with individuals who are sick, especially those exhibiting respiratory symptoms, further reduces the chances of transmission. In most cases, HMPV infections resolve on their own with supportive care. Rest, fluids, and over-the-counter medications can help alleviate symptoms and support the body's natural healing process. In more severe cases, particularly in young children, older adults, or individuals with weakened immune systems, hospitalization may be necessary to provide respiratory support and manage complications. Navigating the future. Knowledge and preparedness as our best defense. As we navigate the ever-evolving landscape of infectious diseases, knowledge and preparedness are our greatest assets. Staying informed about emerging health threats like HMPV empowers us to make informed decisions about our health and take appropriate preventative measures. Following the guidance of healthcare professionals and public health authorities is crucial in mitigating the impact of HMPV and other infectious diseases. Vaccination, when available, remains one of the most effective ways to protect ourselves and our communities from serious illness. While the recent surge in HMPV cases is a cause for concern, it is not a reason for panic. By arming ourselves with knowledge, practicing preventative measures, and seeking timely medical care when necessary, we can effectively navigate the challenges posed by HMPV and other emerging health threats. Our collective response to HMPV underscores the resilience of the human spirit and our ability to adapt and overcome challenges through collective action and a commitment to public health.